Hey, my organic family. Happy Tuesday. Today we are in the apothecary, and today I wanted to talk about something that is very near and dear to my heart. It's something that affects so many people, and it's one of those things that my family, passed down to me. So some people get money as an inheritance. I got illnesses. And so for me, looking at something to help treat my hypertension or high blood pressure, if you will, naturally is something that I am constantly, researching. It's something that I'm constantly actively making products and supplements and decoctions for treating high blood pressure. Now, commonly, high blood pressure is anything that's over 120 over 80. Now, I'm sorry, 120 over 90. 120 over 80 is that normal range. And we're always looking at the top number and the bottom number. And so, whenever you're going to the doctor and you get your blood pressure checked, the doctor is looking at what your heart does systolically and what it does diastolically. Your top number is systolic. That's the number that they look to measure. And ideally, what they want that number to be is 120 and lower. Diastolic, which is your bottom number, they want that ideally to be 80 and lower. Now, when I say higher and lower, that's still a range that we need to look at because you don't want it to be too low, and that becomes hypotension. And hypotension is just as dangerous as hypertension. And so here in the apothecary, we use a couple of things to help treat high blood pressure. Now, commonly, it's not known to use, natural supplements for high blood pressure or even diabetes, if you will. But there are a number of agents that actually help treat, may not necessarily cure, we can't say that. And ideally, they don't even want us to say it treats. But there are a number of things that aid in lowering the blood pressure. And one of the first things that I love in my arsenal and my tool chest for lowering the blood pressure is magnesium. Magnesium is very affordable. It's very inexpensive, if you will, but it's very effective. Not only will you take the magnesium just to help build a heart, but it's also good for heart damage. So if you are a person that has cardiovascular disease, atherosclerotic disease, magnesium is very good. And it's one of these things that we don't test a lot, that we are deficient in. And commonly, a lot of people that have atrial fibrillation and or high blood pressure that's uncontrolled, we add this and actually it lowers the blood pressure sometimes to normal. Now, I would always say consult with your doctor first before you discontinue any medication. And then also, okay, so I want to make sure that you consult with your doctor. Now, I apologize. I was holding up a bottle of vitamin D rather than magnesium. So, as I said, this channel is very organic, so we're actually not going to even cut that out. But magnesium is a strong tool to have in your arsenal. The other thing that I love is yellow root tea. Yellow root tea has known to be very effective for people who have high blood pressure. And in fact, yellow root tea has been so effective in many cases. I tell people you should only be on this about 2 to 3 weeks because it has a tendency to lower the blood pressure and or the blood sugar very effectively. So make sure you're monitoring your blood pressure. Now, how do we monitor our blood pressure? Now, you can get an Omron or some of these electronic blood pressure cuffs. The common error that most people do is when they are checking their blood pressure, they have not sat down for at least 5 minutes. So when you're checking your blood pressure, you want to make sure that you are seated at least 5 minutes. I say go 10 minutes. Sometimes it's hard for us to kind of sit down and decompress. So at least 10 minutes. And then you want to check your blood pressure, left or right arm. I say the least dominant arm. So if you're left-handed, do your right. If you're right-handed, do your left. And then the next thing that you want to do is you want to put your arm into the blood pressure cuff, and you want to make sure that the blood pressure cuff is heart level. Most of the time we're checking our blood pressure down here, and we're in the doctor's office, and sometimes, and most times I should say, in the doctor's office they do your blood pressure incorrectly. You walk into the room and then they immediately measure your blood pressure, and almost never do they make sure your arm is heart level. So that's very important in order to get an accurate reading. So you want to put your finger in the blood pressure cuff, elevate your arm to heart level, and you don't want to just dangle it like that. You want to have something that's supported, and you want to make sure your feet are flat on the ground. And that's how you monitor your blood pressure with an electronic blood pressure device. The last thing that I want to show you is something that we have here in the apothecary. We do two versions of this. One is called Jamaican water, and it's a blend of herbs that have been clinically proven to lower blood pressure, such as hibiscus and hawthorn. Now, we also use many other herbs in this, and so this is our proprietary formula that we use for treating blood pressure. And then we have what is called our blood pressure lemonade. So we use the power of lemons, and we use the power of hibiscus, hawthorn, motherwort, chamomile, all of those things that help support lowering your blood pressure, even lemongrass, if you will. And it's in a blend where it tastes good. So here at the apothecary, we want you to have a healthy blood pressure, and we hope that some of these tips help you keep your blood pressure low. So once again, this is Organic Sister Out. We are here today at Leah Shea Apothecary. Have a wonderful day.